this is the part that you're not allowed to fall asleep. You're not allowed to fall asleep, okay? Don't care how many pills you've taken in the last half hour. Did we all remember to take our pills? I have some lovely, lovely ladies who I've met on my journey, and I'm about to introduce you to the first one. Her name is Gillian Woods, and she's also a librarian. I work at Northcote Library, Gillian works at Takapuna Library, and we're now Auckland Council employees, and we have very, very, very busy lives, but we also share our knowledge about breast cancer and about helping others through the journey. I won't say any more. Gillian, would you like to come to the lectern? And a round of applause.
Thanks, Kim. Yes, I'm Gillian Woods. I have to say, I'm not a librarian, I'm a library assistant, nowhere near as elevated as Kim here. Anyway, I had breast cancer in 1989 when I was 46. I was at first too stunned to ask many questions other than those related to treatment. I have got plenty of questions now. Although the news was an awful shock, I also experienced a feeling of inevitability, as my breasts had already given me quite a bit of trouble. In the 1960s, when I was 26 and about to become engaged, I found a lump in my right breast. It was removed and found to be a fibroadenoma. That's not malignant. The experience was very scary, but all was well. I married as planned, and after a year or so, we decided to try for a family. At first, our efforts did not go overly well. Getting to parenthood was a roller coaster ride, and over this period, I was exposed to a lot of hormones, both natural and synthetic. My first question: could hormone exposure in the early 1970s have been a cause of my breast cancer diagnosed in 1989? My first pregnancy ended in early miscarriage. In my next pregnancy, testing indicated low progesterone levels. So I was given weekly injections of progesterone until 32 weeks, when I gave birth to preemie twins. It was in the days before ultrasounds, and 2 babies had not been expected. It was a great surprise. One baby died soon after birth, and because the other twin was too small to breastfeed, the charge nurse ordered my chest be bound up with bandages to help dry up my breast milk. I remember her saying, "We used to give mums like you an injection of estrogen to dry up your milk, but we don't do it anymore," as very quietly some women in the US had got breast cancer. Sadly, the other twin died after 5 weeks as well. My next pregnancy was under the care of an obstetrician who treated my low progesterone levels with the same weekly injections of progesterone as before. In spite of everyone's best efforts, at 35 weeks I gave birth to a baby who died during delivery. There was a medical reason for this. It was a trisomy D baby who actually would have not lived very long anyway, so there was an explanation. This time a nurse came in on the day after the birth, gave me an injection, and when I asked afterwards what it was for, said, "It's to dry up your milk." I asked later why this had been done after what had been said at the previous birth, and was told it was given on compassionate grounds. I must say I would have appreciated having a choice about this. I had started monthly breast checks before I was 30. Self-checks were strongly promoted at that time. Between pregnancies, I found another lump in my right breast. This time, I was given some sort of early breast x-ray before being admitted to Southland Hospital for a biopsy. What a relief it was when the surgeon came to do the pre-op exam and sent me home because he couldn't feel anything to remove. Can't quite imagine that sort of thing happening these days. About a year after the stillbirth, we adopted a baby boy, and although he was bottle fed, I put him to the breast quite a few times. He thought it was great, and he sucked away strongly for as long as I would let him, but I found it very painful and my breast milk did not return, so this effort didn't last for long. As you can imagine, having this little boy brought us a great deal of joy, and after a while we decided we could try again to have a child. Back in Auckland at that time, pregnant again, my GP referred me to a specialist who would not even consider giving me progesterone, saying only that it was out of date and not done these days. Why had it been stopped? Why in Auckland but not in Invercargill? These questions have still not been answered. Although my progesterone level remained low, the pregnancy was fairly normal, and at full term I gave birth to a healthy baby boy. At last, after 4 pregnancies, my breast cells had the chance to fully mature by way of a full-term pregnancy. I had to thank Charlotte for preparing unknowingly for my talk by handing out some information, which was much better coming from her. I was 33 at this stage, well after the age when a full-term pregnancy confers breast cancer protection, but I didn't know that in those days. Happily, I was able to breastfeed for 11 months, but again, I was past the age to gain breast cancer protection from breastfeeding. My monthly breast checks were a bit of a nightmare, as general lumpiness seemed to come and go. My GP also found it difficult. Before I was 40, I was sent for a baseline mammogram. It was done using a high-dose X-ray machine at the Auckland Cancer Society rooms in Gillies Avenue. This machine produced a remarkably clear picture in delicate shades of sky blue, but it was abandoned quite quickly because of the high dose of X-rays involved. When modern mammograms became available, I had them yearly. My breasts, unsurprisingly, were actually classed as dense, difficult to read. But at the age of 46, a film showed calcifications in my right breast. Found at biopsy to be a small invasive ductal carcinoma. I chose to have a modified radical mastectomy, and as the lymph nodes were negative, I didn't have radiotherapy. I've been reading and thinking about breast cancer and its causes for 20 years. I know now that I experienced a number of things associated with increased risk. I had dense breast tissue, first full-time pregnancy after 30 years, X-rays, including that high-dose blue mammogram, and twice yearly chest X-rays taken while I was working in a TB laboratory. In addition, I had that large estrogen injection in the 1970s to dry up my milk, and weekly progesterone injections over 2 pregnancies. Estrogen, the female hormone, has long been a prime breast cancer suspect, but does progesterone also cause breast cancer? There are a few clues. Take what is known now about HRT. It's the combination HRT with progesterone that increases breast cancer risk more than estrogen alone. What about lifestyle? I was brought up as a vegetarian, non-smoking, non-drinking parents, though we did have a high dairy intake. I chose by my mid-20s to eat meat regularly and drink a small amount of alcohol. Regrettably, I didn't exercise much in those days, but I view it as very important now. I've never smoked. In my wider family, only one aunt had breast cancer. But my entire family, mother, father, brother, and myself, were diagnosed with cancer within just 8 years. My brother got testicular cancer, another one that involves hormones. Neither of my parents were given a primary diagnosis, but died of secondary cancers where the primary site was unknown. I wonder, did my mother, who never had a mammogram, die from breast cancer perhaps? That would be a risk factor for me. But she probably did not, on the basis of negative physical examinations and her own suspicions, which told her it was in the bowel. What was going on with cancer in our family? I was a medical laboratory technologist for many years and was exposed to a lot of phenolic disinfectants and other chemicals. In one department, 3 young charge technologists in succession, including me, had major problems with our pregnancies. Was this a coincidence? Another unanswered question. I've since learned that medical laboratory workers are among occupational groups with higher than average risk of breast cancer. It's worth noting that in the post-war period in which I grew up, the use of agricultural chemicals expanded enormously, and our whole population was exposed to new chemicals, especially DDT, an endocrine disruptor. We didn't, however, have the plastic-loaded environment that children live in now. Is it possible to put these pieces of a lifelong puzzle together, to make any sense from the things that happened, to assess their role in causing my breast cancer? To sum up, my risk was increased by hormones, x-rays, chemicals, possibly a familial factor, and personal characteristics such as dense breasts on mammogram, late pregnancy, and premature births. I would love to be able to tell you which of these caused my breast cancer. Perhaps every one of them interacted as adversely on my breast cells. I don't think it's possible to know, except to say that environmental factors act as triggers, and there were certainly plenty of triggers happening to me in those years before I was diagnosed. I believe it's very important that we keep working to better understand the causes of breast cancer and to disseminate and apply that knowledge so that the risk to the next generations can be reduced. And I want to thank Breast Cancer Network for their continuing commitment towards these goals. Thank you.
Thank you. Thank you, Gillian. Gillian is an amazing lady, and she's also a very private person. So for her to share so much information to so many people here today requires bravery. Thank you. And I recognise it as a fourth generation soldier in my father's family. And part of that knowledge of our family and our history of where they come from and how they are is important to the well-being of our tamariki and our moko, which is our children and our grandchildren. We can help them in many ways. We can teach them their language. And by the way, Māori Language Week begins on Monday. We can teach them song, we can teach them their family histories and traditions, but we also need to know about their medical past, which is us, which is our parents and our grandparents. So my journey eeringly mirrors somewhat of Gillian's, and I didn't know that until I stood here right now. My mother died of bowel cancer at 61. My father, as I alluded to earlier, served in the infantry battalion in Malay Borneo, and I have always had a large amount of estrogen swimming around in my body, and I know that because I have always been an extremely bossy person. And also medical tests. I married a soldier and we were unable to have a child until I was 32. And he was born 6 weeks premature. I have been, of course, as you know, diagnosed with breast cancer in 2009 when I was 49 years old. And I was the fittest, healthiest, non-drinking, non-smoking, healthy woman in the world. So I've always said, how come? How come? But I think I needed to know more about my family. And the difficulty is when your family dies early or your mother is unable to pass this information on. Her mother died shortly after her birth in the 1930s, is that we can't make sense of the now very easily. So my message very simply about myself and to everyone is to know yourself really well and to know your family members very well. And where you can help them most of all is to prepare them for their journey, if you're a woman, for their journey as a woman. I know daughters don't listen, but hey, just keep at it. I would have liked a doctor to have known and understood my mother well. She suffered from depression, and she also, as a nurse, don't you just love this, she was a psychiatric nurse, didn't like visiting doctors. So by the time she got her diagnosis, she was end stage. So I lost the opportunity to learn more about that. With that knowledge, you can inform and help and spread it around. So one of the things I have learned through my larger whananga is that our Māori and Pacifica family members die earlier, are ill a great deal more with a lot of other related diseases. And why is that? And why is that? Their breast cancer journey is similar to ours, but their mortality is higher. And that seems to me very wrong. So I'm going to conclude, because I think you've probably heard a great deal of me, far too much of me, is that I would really like us all to take this knowledge and to help each other. And if there are any questions or if there is any help the Breast Cancer Network can assist with that journey, then we're here to help today, and we're not going to go anywhere, especially if you all become financial members. So as a 50-something-year-old woman, I have learnt today, thank you, Professor Shaw, because without knowing it, you're looking after my family. And I'm looking for my other lady. Thank you very much, because I also learnt from you today. So sharing and learning, that's the key to today. So I'm going to conclude by thanking you for listening to me. And I'm now going to introduce our next speaker. Yes. Can I please welcome to the stage, and I have to say, she's given me a message already, her crutch is not part of her breast cancer journey. Please welcome Barbara Holt.
As I've said in the booklet, my talk is about the possibility my 2 breast cancer episodes may have been partly caused by medical radiation, which I had as treatments and as tests for other diseases when I was young. I'll give details about how young shortly. Barbara Mason, as a retired cancer researcher, I believe, tells me radiation is the only proven cause of breast cancer. I didn't actually know that, but she recently told me that. And Dr. Susan Love writes that research following the atomic bombings of Hiroshima and Nagasaki after World War I showed the effects were greater among women who were in their teens and early 20s at that time, at the time of the dropping of the bombs, and nearly non-existent if they had been in their 50s and 60s. So this is emphasising, look at your early experience possibly for your breast cancer hazards like medical radiation. Now, I know we all know there are different types of breast cancer and different personal histories can produce different risk levels. And in the booklet I say I have 10 risk factors, so that's probably the minimum number I have. It's a bit fuzzy, but that's my mother. As I'm going to mention her in the first radiation response, she was responsible for my first radiation experience. I thought I'd show you what she looked like. But it also shows I was a very large baby. That's the first photo of me that I've been able to find. I was between 8 and 9 pounds in 1936. Now, the thing about my mother was she lost her own mother at the age of 8, and we really don't know why her mother died. She died in a mental hospital of depression, but she had her spleen removed before that, several years before. So there's a big mystery, and I think what Kim said went right to what I feel about my family. There's a lot we don't know, however hard we look. So Dr. Love points out in her latest 2010 edition that any radiation effects received during our lives are cumulative, that is, they're heaped together, meaning each effect adds to the amount previously received. So even though I'm now in my 70s, I believe that, those early ones that I'm going to describe shortly are still going to affect the radiation I get next week, sort of thing. Both my early radiation treatments were for a skin condition I have suffered from since my puberty, which began at age 11, another risk factor. I have a rare genetic disease, sometimes referred to as inverse acne, which consists of the inflammation and blocking of sweat glands in my skin, causing sebaceous cysts, which sometimes become infected. There's a whole lot about this on the web, 14 pages, and I've got a fancy name for this disease, and I only knew the name when I read it on the web recently. And it says there that Spanish Jewish people have a high genetic incidence of this, as do Italian, Greeks, and Middle Eastern. So I was really delighted to hear that, because I've been trying to prove that I had Spanish Jewish ancestry for a long time. It seems I do. It's a rare disease. It's about a 1 or 2%. Anyway, and nobody else in my family that I know of has had it, but possibly some who've died before I was born had it. When I was aged 11, we're coming to my first radiation now, in 1948, living in Auckland, my mother arranged for me to have ultraviolet radiation treatment from a blind physiotherapist. Probably because she had a 2-year-old son to look after. I had sessions alone with this man in a darkish room. A reluctant patient, uncomfortable about the situation, when he asked me whether I also had acne on my chest, I recall I did not give him a clear answer. I don't think I gave any answer, actually. I just wondered where it was all leading and what was happening. So he went ahead and gave me the treatment on my chest that he'd done on the face. It was just like a sunbed sort of thing. I came away, I couldn't smile because there was so much burn, you know. And I only picked this up recently because reading Dr. Love's book, she mentions research shows an increased rate of breast cancer in women in the USA who had radiation treatment for chest acne. So it's page 143 of her book, if anyone's interested. Now, I'm going to press this button again to show you my mother's family. Again, very vague, and you can't read who they are. But the young man sitting is the only one of that family that I was able to meet, even though my grandmother's there and my great aunts and so on, because he survived to 79. The rest died in middle age, one from breast cancer. I'll come back to her. Well, it's sort of relevant to my next episode, because they had a stepbrother who had TB and died at age 19 from the first marriage of my great-grandfather, who was from Ireland. And so I suspect that they all, as young people, and I'll show now some younger ones. My grandmother's the one with the tie, and those are her sisters. And I heard a lot about them as I was growing up, because I looked like them. They didn't look like me. And the one that was in the photo, seated, came to see us when he was about to die, as it were, and he said to me, "Are you going to be all right?" And I sort of knew immediately what he meant. I'd had this burden of these deaths of these 4 women thrown on me all my teenage years. Anyway, a BCN member once said to me years ago that her mother's family had tests for TB. I don't know what year this was, and they later got breast cancer. And I've heard of someone else who said the same thing. So that was my no, we haven't got to that yet. I decided to go to England to get rid of this family sitting on my back, when I was 24. And next picture shows me in England. Can't see it, can you? But that's on a beach in England. I was really very happy to be in England, away from all this, but I lived in a London County Council hostel. The supervisor said to me, would I share a room with a young woman named Joyce who was from Uganda? And I agreed immediately, and we spent 1 week in a small room together in this hostel before Joyce was whisked off to a London hospital for people with infectious diseases. She was diagnosed with extensive TB. I went to see her there, but I don't know how the outcome was because I moved on after that. From that time on, as far as I can recall, for at least a year, even though I kept moving to different London addresses, I received a summons every 3 months from some UK health body telling me I was booked to have another X-ray and must not leave it, So I did that. I was annoyed because I'd had the BCG vaccination, which was introduced in New Zealand in 1948, and I felt very healthy. And anyway, Dr. Love makes a point, which I agree with, I think, that public policy should not override individual choice when it comes to radiation and such things, and even mammography. That there are exceptions to be made. You may think it's a good policy, but it may not suit some people. I'd already had some radiation to the chest, you remember. Suddenly I had these big X-rays, a very old machine going clang, 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 clang. It seemed to go on forever. And I had a number of them over the year or two. I was 24. Then in my 30s, back in New Zealand, I had 11-year OE. I came back in the 70s and I had my third experience of medical radiation for my skin condition. A Wellington surgeon suggested that because he had had to remove large cysts from under my right arm, couple of times, he proposed to remove my sweat glands from under the arm and give me a light dose of radiation. Well, I don't recall him suggesting we discuss any risks of the treatment, and I went ahead and had it in Wellington Hospital. This was about 1977, I think. Wikipedia has this to say: electron beam radiotherapy has been a successful treatment of this disease, which I won't give you the long name, it takes too long to say, especially in Europe. It is not a common treatment option in most of the US, however, as radiation oncologists generally refuse to treat patients with non-malignant diseases because of the potential for secondary radiation-induced tumours in the long term. Well, this treatment actually was very successful. I've never had abscesses under that arm again. However, the other night, looking through my records, I found that in 2009 I had a basal cell carcinoma removed from under my right arm, which I spotted was probably something not good and had removed. So there have been some effects, of course. Anyway, it was a long time before I really associated that radiation treatment with, which was only lasted a few minutes compared with my 6 weeks radiation later after breast cancer. I didn't realise that quite recently really, my first breast lump was found in my right breast in 1987 at age 50, just below the underarm area that was radiated in Wellington in the 70s, about 10 years before. When I was found my breast lump through self-examination, I discovered that I had a choice: mastectomy followed by reconstruction, which the surgeons said I should have because I was only 50, or I could have lumpectomy. No, they didn't actually suggest lumpectomy. I suggested, because I'd read about it in a book by Americans called Our Bodies, Ourselves, and I thought that it would be better to keep my breast and have the radiation. Oh, they said, you must have radiation. And I thought, all right, well, I've had that before, I'll be all right. So I went ahead. And the odd thing is that my great-aunt Anna, who died of breast cancer in 1933, did exactly the same thing. She refused to have her breast removed. She was 59, however, and she had radiation in 1933. Funny little implants, they stuck in the breast itself. Her daughter could remember seeing her with them. Anyway, she died 2 years later, and yet I went ahead. My mother brought me up on this Aunt Anna story, but I went ahead and had the people are hard to understand sometimes, people like oneself. So anyway, we're getting on now to that was my first episode. I said to the doctors, no, I want lumpectomy and I'm willing to have radiation. And I said proudly to the radiotherapy doctor, I've had radiation already. And he was interested then. He said, you better find out how much you had. So I wrote to this doctor in Wellington, and he had retired, but I managed to find him. And he said, told me the amount. I've lost the letter, unfortunately. He also said, I'm sorry to hear you have breast cancer. He didn't sort of apologise or anything, just said that. So then I went back to the Auckland radiotherapist, and he said, well, that'll be all right. You had a very small amount in the 1970s compared with the amount we're going to give you now. So the idea was that the total wasn't going to be a great load, but I forgot to tell him about the chest acne when I was 11 and the 1960s experience. I had buried those, and unfortunately, so it makes a point. Anyway, next thing was I had the lumpectomy and 6 weeks radiotherapy, and I was never happy about the result. I had a much smaller breast because I'd had a very large lump, so it didn't look right, and it wasn't worth keeping, really, in my view. And also it used to look green when I got up in the morning, the radiotherapy breast. Other people have different experiences, and I have to say this, that I meant to say this at the beginning, that if you don't have a risk factor if you don't have the risk factor that I have of never having children, in other words, if you have had children before the age of 30 preferably, then Dr. Love says that that experience overrides the risk from early radiation. They've discovered that. So I'm hoping for those of you who've had radiotherapy that, some of you are in that category, which is lucky that it doesn't have the same effect as it would on someone like me with a high risk for no children. Now, so next we get to, sorry, I lost my place. Yes, so anyway, I had the lumpectomy. They kept me at Auckland Hospital having mammograms every year for 11 years. It turned out they knew, and I didn't, that I had dense breasts, and therefore I'm at higher risk. Just dense breasts in themselves, not because you can't see them on mammogram. You can't see anything on them, but apparently the kind of cells they are more prone to breast cancer. So finally, after 11 years, they said, we think we should let you go now. We usually let people go a bit sooner than that. But I did notice during those 11 years that the operators always took 4 views of each breast. Normally you have 2 views of each breast, and with the lumpectomy one it was very painful to have them. And they insisted on going away and coming back and have another 4. So I had 8 each time. And I used to ask the operator, which of course you're not supposed to do. I should have asked the doctors. The operators would never tell me why that was. Then 15 years later, we're coming now to the end of my experience, I had I discovered my second breast cancer in the right breast. And that's, yes, it's a cue for my recommendation I have to make. But anyway, this time, of course, I didn't have radiotherapy. I was very happy to have a mastectomy. And grade 2, however, they were. So then I sat down and worked out why I had got breast cancer, and I've given you some of the reasons that I think I had it. I just want to get now to this. Sue Claridge, editor of BCN Newsletter, has emailed me a copy of the report of the US President's Cancer Panel, just published in April 2010. Anybody can get a copy going online. I expect Sue's got the address with her. I haven't put it in my notes. But it's a very good report. It's called Reducing Environmental Cancer Risk, What Can We Do Now? And it says there's no mechanism currently exists to enable individuals to estimate their personal cumulative radiation exposure, which would help parents and physicians weigh the benefits and potential harm of contemplated imaging and nuclear medicine tests. I think it's a very good end of quote. It goes on to say the efforts are underway in the USA to develop smart cards on which all radiation doses received by an individual are recorded. And someone's told me today that workers in radiation areas have those already. They get theirs as recorded. I think this information could prevent unnecessary repeat scans and would overcome data gaps, or it says data gaps related to patient recall. As you can see, my recall wasn't very good on some occasions. Final point now. Recommendation here that I have. And I think those cards would be excellent if we could get them in New Zealand, but I believe that BCN New Zealand now could make this recommendation or something similar to our government. We believe breast cancer patients need the right to know the dosage of all radiation tests and treatment offered to them, and to have the chance to accept or reject them in writing. And I've added, after all, patients have the right to know the degree of risk in procedures like colonoscopy, which I've had under informed consent since 1987. You can say whether you're going to, 1% risk I was told for perforation of the bowel, so you can say whether you're going to go ahead with it or not. And I think maybe those recommendations might even just need amending to cover radiation procedures. Because in my recent experience in hospital, I wasn't asked at all, whether I wanted things. I had to say, I don't want that. I'm not going to have that. But there's no question of signing anything. I could have said, I'll give it to you in writing, I suppose, that I don't want it. There are various things I've thought of since. But the situation at the moment is bad. You can be sent for a CAT scan with just because they think they're suspicious you may have cancer, as they were with me because my leg had broken. And so that's my story.
No your whakapapa. Can I introduce our second to last speaker? Can I invite Anna Mackie to the lectern, please? I'm so sorry to do that to you.
I'll just put these up a bit. Hello, thank you for having me to speak today. I think I was asked for 2 reasons, one being a very Auckland or New Zealand reason, in that Barbara Mason, who's organising it, knows my mum, and they nursed together, or they trained together at nursing school. But also, obviously, I had breast cancer, and I have a pre-existing medical condition, as I've said in the book. I have rheumatoid arthritis, and I guess it's always been my perception that potentially this condition, or the management of my arthritis, may have contributed to my subsequent breast cancer. However, scientifically, I can't really prove that, and it is just my perception. And I work as a health professional in medical research, so I know making claims on just my story is not that valid. So just take today as I said, my anecdotal story. We've actually banned the word journey, haven't we, in our household? So I don't say that. Anyway, I was diagnosed with breast cancer in early 2009, and it was a triple negative, so negative to all the hormone receptors, and had the rest of the year of treatment, so surgery, chemotherapy and radiotherapy. I guess as a disclaimer, being just 3 years out, although some people may be less, at times it can still be a bit raw, and I hadn't realised, and even preparing for this talk made me a little bit upset at times. And I practiced my talk to my partner, Jeff, and he said, "Oh, Anna, I think you're getting a bit emotional." So it's not the boy version, but this is the revised version. He suggested bullet points, but anyway. I guess the first point, which is what we've all said, is really I don't know what caused my breast cancer, but I guess it is my perception that potentially my rheumatoid arthritis and the medications I was on may have been a contributing factor. So, and I'll give you some background. So rheumatoid arthritis is an autoimmune disorder, so your immune system attacks the lining of your joints and muscles, and it's an inflammatory condition, so you get painful, inflamed joints, and it can lead to degenerative changes in the bone. And it can occur at any age, so from childhood through to older adults. So I was diagnosed at 20 or 21, and it differs from osteoarthritis, which you get generally for age and wear and tear and external factors. So the management of rheumatoid arthritis is with pain relief and anti-inflammatory drugs, but also then with disease-modifying drugs or immunosuppressant drugs. And so they do what they say, they suppress your immune system so it won't attack the lining of your joints. And so for me, I trialled a range of them after I was initially diagnosed to try and find one that would try and halt the disease progression, and eventually was on methotrexate for about 14 or 15 years. And so methotrexate is actually a chemotherapy drug as well, but in higher doses, but otherwise used for a range of different autoimmune disorders. So for me, actually, it worked really well. I was studying at the time. It enabled me to finish studying and get a job and go on my OE and have a good quality of life. I couldn't do lots of things. I couldn't get back to playing sport. I'd been quite active, but I could do many things. I also couldn't drink alcohol on this medication, so I did miss out on the whole binge drinking phase of student life. So I'm pretty sure that excess alcohol consumption was not the cause of my breast cancer, unfortunately. And in hindsight, I actually had a fairly healthy lifestyle, and that was really just to try and manage my rheumatoid arthritis as best I could. I guess we did know at the time that potentially methotrexate had been shown to be linked to increased risk of malignancies later on, and I think if you look at any medication, it has these sorts of side effects, particularly lymphoma, and it's not good for your fertility either. So I think, however, I was 20 or 21 and I'd been really sporty, and to have that taken away from you, you want to get back to some normality. So I don't regret that I took it, because it did give me a lot of quality of life for 15 years. However, I guess my immediate response to being diagnosed with breast cancer was that it had been that medication I'd been on for 15 years that is working so well. So I stopped taking methotrexate that day, and I haven't taken it since. But it is just my perception, and I think when Barbara asked if I would do this talk, I thought, I better look in the literature now. I'd kind of carefully avoided Google. I just didn't want to know at the moment when preparing this talk. And so I didn't find any direct evidence to say that there was an increased risk of breast cancer with rheumatoid or long-term methotrexate use. However, I imagine there's probably not lots of us out there with that group of things together. But there was definitely evidence on the use of immunosuppressant drugs causing increased risk of malignancies, and we'd known that ourselves when the doctors had first put me on it. And this was particularly been documented for post-transplant patients who are obviously on immunosuppressants for life after they have a transplant. But like a lot of research and working in the research field, it always says at the end, there's really insufficient long-term follow-up studies to know the true incidence of malignancies with immunosuppressants above and beyond the normal population rate. So we don't have a really nice long studies looking at 20, 30 years on. However, some of the studies that looked at methotrexate use in arthritis and increased risk of malignancies had said that potentially other contributing factors could be the inflammatory nature of the disease itself, the multiple medications that you're on, that your immune system is suppressed, and maybe this makes you more at risk for infections and viruses, which could lead to malignancies. But we don't know, or don't seem to know anyway. And I guess I was thinking about it, really the reality is there's not actually a lot of choice. So if you're a transplant patient or even with a range of autoimmune disorders, it is about quality of life. And so, as I said before, I don't regret taking it, but it is perhaps one of those things in hindsight you think about. I guess the other thing have come to me when I was preparing for this talk was just how strongly your perception of your illness really influences your behaviour, rightly or wrongly. So for me, even though I don't find a lot of direct evidence to say that methotrexate has led to your breast cancer, I guess it will probably always be my belief. In some ways it helps me cope and gives me that little sense of control that I've stopped taking the medication, so I'm going to be okay. And we probably all have those. I mean, I know people who have become vegan or vegetarian or drink green tea, and it's all kind of a sense of control that you can do to try and prevent, or hopefully prevent it coming back again. So the downside for me is my rheumatoid arthritis hasn't gone away. We were hoping the chemotherapy would blast it away, but it didn't. But it's definitely the lesser of two evils, so I just manage. So the final bullet point I was going to contribute, I guess slightly in keeping with today's sort of theme of considering the bigger picture when we look at cancer and what it causes, is really from a perspective of someone with multiple medical challenges, and I think probably all of us have some medical baggage, which I hear when I heard the other ladies speaking today, is that you do want someone to be looking at the bigger picture of you. And I know when I was first diagnosed, I had up to 6 consultants for all my different health problems that I was seeing at different times. And I thought, well, actually, there's no one person out there who can link all the dots and say, oh, is that my rheumatoid arthritis or is that secondary bone cancer I've got? And it just, obviously it scares you and you really don't have anyone who can tell you that. So you sort of have to work your way around different consultants and you end up trying to join the dots, generally not very well. But my advice from that is get yourself a fantastic GP, which I've been lucky enough to do, so she can reassure me even if we don't really know, but that's okay. I said to my mum I would love to have to speak to a room full of rheumatologists, because I think, even though I don't have scientific evidence, I think if a young woman came into their clinic rooms and they were going to put them on immunosuppressants, there are a few things I could advise them on. So thank you again, Breast Cancer Network, for having me to speak, and I hope that we all take away that just looking at the bigger picture of an individual's health can help us get a better understanding and improved outcomes. Thank you.
Becoming advocates, it's so important. We become advocates on so many different levels. Because I'm the speaker, I get this opportunity. I've remembered something I meant to say. Pain. Pain was the single scariest, awfulest outcome of my disease. It continues now. The support that you have from the people around you is so important. And I have now, after 3 years, managed to connect with the pain clinic. One of the things that I have learnt, which echoes your thoughts, you have this doctor for this surgeon for this oncologist for this, but no one ever actually sits you down and says, how are you feeling today? And how can I help you tomorrow? Maybe that's just one of us. I have the absolute pleasure now of inviting the most photographed woman on the shore, for the North Shore Times anyway. Violet. Violet is a wahine that I don't know anybody quite like. And you'll understand after she finishes speaking to us exactly what I mean. Kia ora, welcome. Hara mai, Violet.
Oh, where's the picture? The picture she was talking about is me. And I'm famous again for the 13th time. So I'm doubly famous. Okay. Kia ora. No mai, haere mai. Ko wairete toko ingoa. Ko Ngāti Kahungunu toko iwi. Ko Ngāti Pahuera toko hapu. Ko Tauwhirirangi toko maunga. ko mohaka toko awa, ko mohaka toko marae, ko takitimu toko waka. That is my iwi, my hapu, my mountain, my river, my canoe. That's me. Okay. And I shall continue our journey. Myself being a 5-time stroke survivor, and I went through a bad patch. I went through depression, everything you can possibly think of. But it didn't stop me from training for the New York Marathon. I participated in the New York Marathon in 2006, 2007, and 2008. And I was going to train for the New York Marathon in 2009. It was not to be because I was to have a breast reconstruction after all this hoopla and the illnesses which combated to where I am today. So we shall continue my journey. On the 22nd of December 2009, I was self-examining my breast and found a lump on my left breast. I had a mammogram 9 months ago and had been given the all clear. James, my husband, my tane, immediately drove me to A&E at the North Shore Hospital and spoke to the emergency doctor who examined me. Arriving home from the hospital, the radiographer called saying a lump was detected and I needed to go back for a mammogram. So began that day that changed our lives forever. By early afternoon, I had a mammogram, ultrasound, and a biopsy, and I knew instantly that I was diagnosed with breast cancer. You don't need to be a rocket scientist to figure that out, and I will continue. We knew from the radiologist's reaction to the ultrasound I had breast cancer. Christmas is approaching and the medical staff is ready for their vacation. And I was ready for another challenge. Rosalind Bowring from Taha, practice leader and coordinator from Taha Oranga, was on vacation and called me straight away. We liaised regularly by text messaging until she arrived back at work in January. Rosalind drove me to so many appointments, such as chemotherapy, blood tests, cardiology, Green Lane Hospital to monitor my heart, my fitting of my Waka Blonde. I had this beautiful Waka Blonde because of the baldness from the chemotherapy treatment. Domain Lodge for the psychologist's appointment, and Look Good, Feel Better, a morning of being pampered by the beauticians. It was just a beautiful occasion. I was in cycle 3 at that time, and I was on my downward spiral from chemotherapy, and they caught me the day before, so we went along, and I was pampered by these beautiful ladies at the Domain. Rosalind is invaluable and a kind, generous, beautiful wahine. I highly recommend her to anyone else who has been diagnosed with breast cancer. She exudes so much happiness and laughter and gave pleasure to my life while I was gravely ill. 7 months ago, I had a tram flap, a breast reconstruction, and recently my other breast was uplifted. In a few weeks' time, my breast needs more surgery, my left breast, because the plastic surgeon said to me, she examined me half naked and she said, look in the mirror. So I looked in the mirror and she says, nothing wrong with my breast, my boobs. She says, look deeper. So I looked in my left side of my breast and she pointed to me, if it's possible, what we could do is do surgery. And I said, well, how long will that take? She said, we'll take 5 different surgeries to enhance my breast because it has a bit of a dip, a little lump there. And I said, 5 occasions, why don't you just do it one off? And I will go home and feel happy and so on? She said, no, because what happens when they perform the surgery on you, she allows a week to rest your body, and then she will continue the following week and so on. So I'm having surgery next Tuesday, so they rest for a week and then I'm back for more surgery and so on. So they associated with that to where my breast will be beautiful once again. It was bare with scars and everything else. Now it's gorgeous, my boob. I'm loving it. You should too. Come on, ladies. You love that? Love your boob? Well, I love mine, both of them now. Okay. Yes. As a mother of 2 children, I gave birth to my tamariki, which is children, before I was 20. My first born, I was 18. My second born was 19. About 14 days before I turned 20. So I was a child. I was children having children. And now my children are 39 and 38. And I have so many mokos, I cannot believe. Which is just beautiful too. I have 12 mokos altogether. I hope there's no more. So help me God, yes. I can't afford them, that's right. I'm amazed that Kiwis and other ethnic cultures eat far too much processed food, devoured as if there's no tomorrow. How sorrowful my people are, obese, fat and heart attack material. I grew up in Mohaka and our food was grown in the garden, in the paddock. We're self-sufficient. We grew our own kai, our vegetables, our fruit and watermelon and so forth every year. When the food was ripe, ready to be picked, and corn, we would invite the whānau over. So there was all of 50 people would congregate to the house, and we would have like a hangi. Just like all the whānau would bring their meat and their one of bread and more kai. It's like, God, it's wonderful. More alcohol too, and so on. So this is one of my whānau. My whānau, Beatrice, another breast cancer survivor, had other things on her mind. Smoking, bugger. She was a chain smoker. She was disgusting. This wahine needs to quit instead of killing herself by smoking incessantly. Statistics have shown that this killer is on the increase and is one of the diseases that are killing my people. So what does this mean? What does this mean? A lot of my whānau have died from cancer. My mother she's 87 years of age, and she was not diagnosed with cancer, breast cancer, or any cancer of any kind. And same way with my siblings. There's 8 of us in our family, whānau, and I'm the only one that was diagnosed with breast cancer. So hate to think. I smoked and drank as a teenager, but not anymore. No, because as you get on in life, you realize that having all these toxins that you inhale and toxins that you consume is deadly, and it's critical. It's time that people need to wake up to reality and realize, well, once in their lifetime, it is a deadly disease, and it's a killer disease. And there's a lot of kids up today and walking up and down Queen Street and the bars and so forth. It's unbelievable. These kids are intoxicated. It's a terrible sight to see. Anyway, I shall go on. I met Janice Wood, breast specialist nurse, and asked, why are so many women wahine dying of breast cancer in Aotearoa? This baffled me for quite some time, and I needed some answers. She knew the severity of this disease and answered appropriately. Anyway, becoming informed about the facts on breast cancer, becoming involved and knowing how detrimental food, smoking and alcohol can be. This has concerned me about the lifestyles of my waihere, their choices to smoke and drink and eat unhealthy food. Today, as a multiple stroke survivor and a breast cancer survivor, to spread the message about what it takes to stay healthy. I would love to be a spokesperson for Māori and Pacific Island waihere, be a voice and speak from the heart about my journey, an invitation to what I believe in, and talk to women and men who care. Talking is a healthy way for recovery, and by asking questions helps. Become informed and speak your mind. That's about it. Share knowledge, spread hope. I am one of millions of cancer survivors. Māori woman has the highest mortality rate of breast cancer throughout the Pacific. This is a tragedy, and I pray to God for solace and hopefully get my message across to all waihere. And in conclusion, this is how I would approach this by saying, you can't kill me yet. I have 50 years plus of life to live for, and I'm sticking to it. Kia ora.